Welcome. My name is Monica Mae Leibson, and I am here with Natasha and Amber from Live Light Birth and Family. I am an acupuncturist of 18 years this year. I'm a full-grown adult. And I also am a trained birth doula as well as postpartum doula. And so I wanted to teach these birth doulas today about acupressure during labor. So we'll start with our first handout. On your left there, acupressure during labor. And the way that this handout is laid out is the pictures are on the front and the second page, and then there's some information under. I'll go over that. Then on the third page is the actual location of each point, and so I'm going to review those as well as what they're good for. Next page is location. The following page is points and actions or indications at a glance. So that's so wherever your patient is in the process, you can look at this and say, okay, what should I be doing now? Mm-hmm. And then here's some possible point combos at the end there. Okay. All right. So let's start with, let me start with a real quick story about why I am so interested in this, which is that I had a difficult first labor and not really the support that I needed, which is what called me to become a birth doula. Mm. And in my second, I hired, even though I was a doula, I hired a midwife and a doula, a home birth midwife, so she's only watching me. But I said, I just want her to focus on safety, and I want a doula who's going to be my mommy and take care of me. Mm-hmm. you know? Mm-hmm. And she did the acupressure during labor, and it was so helpful because essentially what I find that happens is there is only so much type of pain that the brain can take in at once. And so this is what helped to be a pain blocker. So I remember while someone was doing acupressure during contractions, I would say harder, because the more that they did it here, I felt this and less of this. Okay. So that was my personal experience. I've also had, and I'll bring up some more anecdotes when we talk about specific points, but I've also had really great feedback from patients about acupuncture during labor as well as acupressure. Mm-hmm. I will say, I've been lucky enough to be with Natasha at a birth, and it was amazing, and I really had never seen anyone do what you did, which is, I think, very oxytocin driven. Mm-hmm. That's what I saw. I just saw you with your gentle rubbing, massage, lotion, very smooth, just so that she could feel those bliss hormones, right? Mm-hmm. Yeah. I definitely recognize that, and I think at the beginning of labor, that is 100% what we're going for. You guys know that. We need to release that oxytocin so that once they get into the pain chemicals, they can block it a little bit with some of that they built up in those receptors. Acupressure is not that gentle or loving. Okay. Right. It's more, I think, best used for later. Okay. I mean, it can be used at different times earlier too, but especially I guess what I would say is acupressure, I think, is best used during contractions, and then after contractions, we want to be doing the gentle touching to get, again, that buzz, that endorphin buzz.
That makes sense.
So, yeah. My second, I had such a great experience. Let's start on page 3, point locations and indications. And I said there is a lot of points in the ears. There's over 200 points in the ears. They're very tiny and close together. Okay. There are ear seeds that patients can use that are not, the actual needle. But I actually find that this way is the better way to just get all of the points. So the directions are: manipulate the entire ear, rub it, and when you release it will start to feel hot. These are good for pain during the entire birthing process and a great tool to use at the beginning for endorphins. So essentially, what you do is you rub your ear from the back to the front all the way up and around that curve. You can just go up and down, basically, even a little pulling. And you'll feel your ear will get red and hot. Mm-hmm. And actually, if you take a deep breath on that, There's a little buzz to it. The innervation of the ear goes right to the brain. So this is really to help us get out of that fight or flight and into rest and repair. So that's a great thing to do at the beginning of both. I'm sorry, you do both, but at the beginning of labor or like in between the heavier contractions later.
Okay.
But you do tell them this doesn't feel great, but afterwards I want you, once we're done, I want you to just breathe and relax. And women can do that during pregnancy too for stress and anxiety. It's all these points are for stress and anxiety because they're hitting the brain.
Okay.
Yeah. So let's start then with gallbladder 21, and that's going to be the first picture on the front. So this is a very, very easy point to find because everybody is tight here.
Okay.
This is at the crest of the trapezius muscle. So just grab your shoulder and you'll feel it. I'll show you just in case but basically it says no, it doesn't have that. Okay, so if you feel like right where the neck connects, right where the shoulder connects to the neck, and then right where the shoulder connects to the arm, it's like right in the middle. And basically you just feel for someone's down their trapezius and you can feel for the kind of spot that's the most tender. Yeah.
I can feel that right away.
You mind if I?
Yeah, yes,
okay.
please.
So here's where the neck and head connect, and here's where the shoulder, and it's like right in the middle. Yeah.
Okay.
So the biggest action for this, see if you can sense this at all. I don't know if, you might have to be a little bit sensitive, but if you can feel like a downward bearing, you know how it almost makes your shoulder go down, like when I touch it? So when you touch this point, you almost feel your whole body go like that. So this is the best point for what we call descending the chi. So bringing everything downward. So this is for pain relief, help to bring the milk in. Obviously, this is all connected here. So if a woman's like this, it's like we need to breathe, bring it down, do some neck and shoulder rolls. But yeah, it's great for that. It's also used for high blood pressure. Again, bring everything down. But I would say imagining pushing is what this point is best for. And actually, I had an OBGYN who told me that was the best pushing I've ever seen from a first-time mom. Wow. And what happened was every time she was going to push, we would take a deep breath in together, and then I would just bear down on those points while she pushed, and then I would rest, and she would rest, and then we'd go back at it. And she just said, wow, I've never seen more effective pushing on a first-time mom.
Wow.
I like that, too, because a lot of times during the pushing phase, I don't feel like there's much for me to do. Words of encouragement.
Yeah.
I might be the one holding
the leg,
helping holding the leg.
Holding the leg and like encouraging, like you're saying.
Yes. Maybe possibly to like move and stuff. Yeah. And very much I'm like checking the tone of the space. Make sure like the provider's still listening and being respectful and whatever. It's patient centered or however you want to say that. But I love this. I think
it's nice to have something to do.
Yeah, and I feel like it would be.
And
also
if you
take
get
away.
tired, you can do your elbows, or if you're just like above her, like if she's on a bed, you can just be pressing down on this whole area, and it's just bringing that real downward bearing. And then the other spot that's really great, well, I don't mean to jump around too much, but kidney 1's at the bottom of here. This is the other spot that's really great for downward bearing, and this is at the very bottom of the foot. So it's like, this is like the top of the body and the bottom of the body, to bring things down. It says on the sole of the foot between the second and third metatarsal bones, approximately 1/3 of the distance between the base of the second toe and the heel. You don't have to memorize that, but watch. Every acupressure point generally is in like a crevice of the body. Right. So do you see that right there is like a little dip? Yeah. This is where everything comes, so it's right in there. And so you can do this with one thumb, usually is probably the best way to do it. And then you can also just kind of go around it. But this is another great thing during pushing is holding this down while they're pushing. Okay. Yeah.
They kind of could give them like a point of like a direction.
Imagine. I say that in my acupuncture treatments. I'll say, when I leave the room, I want you to imagine that your breath is coming from the bottom of your feet, and as you exhale down into your feet. So yeah, it's very grounding. And actually this point, kidney 1, is used a lot. It says for fear and anxiety. So gallbladder 21, along with kidney 1, when people are really stuck up here, it's like these are helping them to get into their body a little bit more, because this you have to feel.
Yeah, for sure.
And this reminds you that there is a body between here and there. You know what I mean? It's really grounding.
Do you think it would be beneficial if someone had an epidural?
That was my question.
Yeah. It's still, I mean, I think that they don't have to feel the points for the energy to be there.
Okay.
Definitely is still working on energetics.
Okay.
But I think if they're completely numb, you might want to go gallbladder 20 instead.
Okay.
Sorry.
Gotcha.
So just, if you go down there and say, like, do you feel this? Are you getting any sensation? I guess read the room on that one.
Yeah.
But yeah, I hear what you're saying. You can get seasickness bands to use and walk on them. So some women will put those bands and then just walk around on this. And again, it's just like bringing them back into their body, as long as they're safe doing that.
Right.
And relaxes the genitals. That's another thing is, I went to a birth recently and did acupuncture, and she said, oh my gosh, it isn't until I actually can relax my pelvic floor. People have been saying that to me, and I had, up here, she goes, but now that you did this and I had a contraction, I really see what it means to have a relaxed pelvic floor.
Wow. Okay.
So yeah, I think this one is, the kidney energy from down there definitely comes up and into the reproductive system. Yeah. All right, so let's go back to the middle, large intestine 4. And if you want to look on the front again, that's the one I was showing you originally that's on the hand. This is the one everyone knows, and essentially, the location is on the dorsum of the hand between the first and second metacarpal bones at the midpoint of the second metacarpal bone and close to its radial border. But I'll tell you, this is one you feel for, so I'll show you where it is. It's not in this like skinny area, this fleshy area. It's further in on the muscle.
Oh yeah.
Let me show you. So it's right here on the muscle. And a lot of people are sore from all the work we do with our hands anyway. But this one is great for getting things moving. So if a woman has stalled out, or if she hasn't started to begin with, and they're considering induction or whatever, this one is for getting labor started and keeping it moving. So this is, it can be used also for pain relief. Like I said, I used it, and I remember them pressing harder and harder. And this is really well known for pain relief in acupuncture. But I would think of this one as the thing that keeps labor going, not calming it as much. You know what I mean?
How frequently do we do this? Like, is it like, I would like with this one, would be for pain, it would be during contraction, I'm assuming. But if it's like a stall, how?
No, this is a great question because I skipped the whole thing about how to perform acupressure. So let's do that first. Okay, so this is how to perform it. I'll go over it really quickly. First, you locate the point, and like I said, many points will feel sort of the touch. So if you're touching someone and they're like, I don't know, it's not really, then like wiggle around and say, oh, is it more here? Basically, someone will go, ooh, that's it. When they go, woo, I felt it. That's the energy, that's the chi, that means you hit the spot.
Okay.
Press firmly on the point. It is not massage, okay? This is not something
I felt that, like, when you did it.
Yeah. You can do stuff like this, but for it more, you're more likely to get it if you're just, like, holding that spot and letting the energy come to it. And you can use your knuckles and elbows. The point may feel bruised. Like when any woman that you touch, their spleen 6, every woman goes, oh my gosh, do I have a bruise there? It just feels like that. That's normal. And then I said, just be sure to check in with the mother, see if she's okay with the pressure. The point should have an effect. I said within 5 to 10 minutes, move on to different points if that does not appear to be effective.
Okay.
Essentially, there should be like a immediate impact and then a longer term impact. So the immediate should be like when you touch it and I'm having a contraction, whew, this is helping right away. But then also if we build this up over the course of your whole birth, hopefully you're less in less pain than you would be. Start in early labor. The earlier you can take advantage of endorphin release after each contraction, the less pain women will eventually have. All points can be used for pain relief, comfort, anxiety. It will depend on the mother and her individual preference. So you don't have to be like, this is used to be, I can only do this. She's not presenting with this weight. You really just know this is all her body, and we're just assessing and kind of tuning into what feels good to her. That's really the best thing, is whatever she's like, oh, that helps, use that.
Stick with it. Okay. Right.
Essential to try out different points and get feedback during and after contractions. Not every point will feel useful for all women in labor, but there are no negative side effects. There's nothing that's going to ever go wrong. This will not put someone into labor if their baby is not ready to be born.
Okay.
You know? I always say the system doesn't override itself.
Yeah.
You know, so the body is smart enough to know. Yeah.
Right.
Pre-labor preparation, you could do this. I've given this to a lot of my patients, and I'll say, starting at 37 weeks, I want you to start doing these points, have your husband do them, so you guys are familiar with them before the day of. And then the acupuncture protocol, which I gave you another handout for, this was pre-birth acupuncture protocol is once a week starting at 35 weeks, and the goal is to reduce, they did some research on it and showed that women that had acupuncture once a week starting at 35 weeks, they had a shortened labor by 6 hours and 30, basically an hour and a half. Decreased medical intervention, 31% reduction in epidural, 32% reduction in C-section, and an overall 35% number in the reduction of inductions. And then also for breech and posterior, we'll talk about this a little bit more, but it's good. We always want to aim to prevent that rather than have to fix it, because you know it's much easier to prevent. I talk to all my second trimester patients now about reducing their sitting as much as possible. I think that's one of the biggest problems.
How they sit, for sure. This, this back is creating that hammock and stuff.
Yeah, exactly. So back to your question about how often to do this. Were we on LI4 again? So for that, I basically would do it during a contraction.
Okay.
So if her contraction is a total of 2 minutes, you want to do it during the 45 seconds that it's the most intense.
Okay.
Until then, you're okay, you got this, you're doing the gentle, and then basically you're matching her intensity with your intensity of how it is. So, all right, then we'll go to, any questions, you guys?
No, I feel like that's clear.
Yeah.
Okay, good. Spleen 6, this is the one I was showing you, is on the medial side of the lower leg, superior to the prominence of the medial malleolus, your internal ankle, in a depression close to the medial crest of the tibia. So here's the tibia, you got the bone, and then basically you measure if their hand is similar to yours, because you're supposed to use 3 fingers above the, I don't think this says it on here, I don't know why, but anyway, 3 fingers above the ankle and right along the bone, and you'll hit, again, a little bit of a divot. It's you got to feel gently to find it. I'll come help you guys. But even if you couldn't find it and you go right along, these are the areas that are swollen and sore on women in pregnancy, So I'll show you.
Right here.
Okay.
I know.
Here, put it on here. So here's your ankle, and then here's the tibia. And then we have pretty similar. So it's going to be like, and I think mine were a little bit tinier, so maybe right over here. So I just feel for it. You feel how I landed in a little depression right there? That's the depression. So you feel how that feels like you have a bruise? Yeah, that's it.
Interesting.
So here's your ankle, and then here's your tibia. And so, yours is
mine is low, right there. Okay.
It just goes,
right. It did.
So again, when a woman is swollen, you may not feel it as easily, but you could go up and down the tibia, and you'll be getting good. It's all the spleen channel is from here to here. Okay. Well, it really goes up into here too. But so anywhere along this, you're going to be getting good chi and good response. And this one is one that goes really well in tandem with large intestine 4. So spleen 6, acupressure technique. I don't know why this got put here, just under this one. Direct pressure applied with I read over this whole thing, but I missed that. I recommend using this point one leg at a time for approximately 60 seconds, then can be used in the opposite leg later for 60 seconds. So this one, again, is to move things along. Spleen 6 and LI4 will help to keep things steady. Okay. So any irregular contractions or slowing down, you want to address the nervous system, because you guys know that already, that if there's a slowing down, the nervous system is saying, I'm not safe, something's wrong here. So we try to address the nervous system first by verbally, like, connecting with them, seeing what the thing is, the issue is. You guys know that. But then you always have to tell the body it's safe now.
Right.
So this one's used to aid dilation, again, to keep things moving forward. Encourages efficient labor, and also used for after pains, postpartum.
Okay.
This one is really well known in Chinese medicine to be like the number one point for femininity. Any feminine issues, any reproductive issues, heavy periods, painful periods, emotional PMS, all of it. The liver, spleen, and kidney meridians all meet right here, so it's one of the most yin points on the body, and the yin is the feminine while the yang is the masculine. So that's why I said any woman you touch, it's gonna be tender there, because it's just a real hot spot for women.
Okay.
All right, so bladder 60. This one is more specifically for positioning, wanting to help get the baby in the right position. So if we start to think, for some reason, like, why isn't this baby coming down, or maybe there's posterior, they start thinking all those things. This is a good one. So this is right over here, behind the ankle, and the depression between the prominence of the lateral malleolus and the Achilles tendon. So what I do for this point is I just squeeze it on both sides, because there's the kidney meridian is on the inside and the bladder meridian is on the outside. And so the kidney is for the adrenals and for anything for calming down the nervous system. And so the bladder, this one specifically, and then there's also bladder 67, which is the one that's really well known for breech presentation. Okay. So this could also be for breech. It's any positional thing you want to think going here. And this is not going to be used like during contractions, or, it's really not for that. This could be an in-between, or if a woman finds out at 34 weeks that her baby's in the wrong position, then she should be utilizing that point.
Okay.
Like this later in labor, uses spleen 6 to reposition a baby in posterior, promote efficient labor, efficient delivery, and good for calming. All right, so then, like I was talking about, bladder 67. This is the point that's basically on the outside of the little toe, at the bottom of the nail bed, the very lateral side. It's just right there. And it says, at the junction of the lines drawn along the lateral border of the nail and the base of the nail. Okay, and so this point's usually stimulated by using those ear seeds, like I said, like you can put something right on it. Or you can even mark it, like if you want her husband or partner to do it, you can mark it and then he can do it. But what I said is you can be doing this, also stimulate it with a instrument or a fingernail.
Okay.
So this is not really something that you're moving or anything. It's just right there in that little spot. You're just going to be holding it down, and you do feel a little tension when you do that on the point, So continuous pressure applied in this way for 5 to 10 minutes has been successful in helping a posterior baby turn to a more effective position.
Should the birther be in like an inverted position, or can they just be like sitting? Or
basically, anything that you're doing to move the baby anyway, you can add this.
So they can be in like the little incline.
Yeah, exactly. Like they can be in any position and do this.
Puppy pose. And then, do you want their foot, like for bladder 62, do you want their foot to be flexed, or is it okay if it's just a little bit loose?
It's loose is fine. Any position is fine, really. That's the cool thing about a lot of these points is you can get to them. You don't have to say, okay, now you need to do this so that I can get my points. It's like, no, now you're like this. Okay, I'm doing this point.
That works best for labor. Yeah,
exactly. Yeah, that's what, when I've done acupuncture during labor, it's just a lot of in and out. Like I'll do a few points and then, okay, now I got to go to the bathroom, or I have to do this. I got to get in a different position. I'll just take them all out, and then we'll see when's the next time to do a few points.
Okay.
So this 60 and 67 are mostly like location based. You're thinking about baby's position. And if you want to get something to stimulate it, you could get it's like little pens essentially that are for stimulating acupressure points, or you could get like a pack of ear seeds, and again, people can use those for anxiety, or they can do the ear manipulation that I told you about earlier. Okay. All right, so last one is pericardium 6. This is the one that you guys know for nausea in the first trimester. Mm-hmm. But as we know, nausea also comes up during birth. Mm-hmm. So same thing, I'm not sure why. Anyway, on the flexor aspect of the forearm between the tendons of the palmaris longus and flexor carpi radialis, basically these two big tendons, it's right between there, and it's usually 2 to 3 fingers underneath the wrist crease. So you put your finger there and then put your thumb like right after it, and then it'll be right there. And this is one that women, you definitely feel. Mm-hmm. It feels a little nervy in there. Mm-hmm. And I found this to be something that helps women immediately, but it doesn't last. So, with something like nausea in the first trimester, women will immediately feel better, and then 2 days later, they're nauseous again. Right. And I say, well, that's because I'm not treating your pregnancy to go away.
Yeah,
so the pregnancy, relief. Yeah, it is. It is a temporary relief. But you know what? It's all about tools in the toolkit. Yeah, so it's usually like right here, and what you can do is kind of go along until you find the spot that feel right there. Do you sense that?
I think when you were down there, I feel
right here.
Okay.
Yeah. Okay. So again, some women might feel there's closer, like the energy closer to the wrist. Some women might feel it more over here. Mm-hmm. I would try, if you could, with this one, if you notice someone starting to dry heave or whatever, like try to do it early. Mm-hmm. Just like anything, once it's too far gone, it's really hard to catch up to something like that.
Right.
So, but that's generally used, for nausea and vomiting during labor. And I definitely have seen women, use that almost like between contractions, like during they're kind of focused and doing their thing, and then in the middle, or between a contraction, we'll do that P6 so that they can feel less nauseous and more calm between contractions. Yeah. All right, and then after that, any questions?
No, I like this. I like it too because I think you can involve the partner quite a bit too.
Yes.
Like you said, give this handout to them, give them this information, and then they can be comfortable talking to each other, expressing I need it to be harder, or do that more, or no, I don't like it, and then, everyone's familiar.
Yeah.
I've told the story so many times to my patients, before having kids, I didn't need my husband, right? I got married to him because I loved him, not because I needed him. But once I had children, I was like, I need you. We need to be partners in this.
Yes.
And I think the birth can sometimes be that first time where that really shows up. Mm-hmm. And I was not expecting that and didn't know what to do. And so I talked to them about that, this is a time where he can support you in a way that you may not have felt supported by him before. Mm-hmm. And this is a great tool. Like you said, I remember my doula in my first birth had my husband hold my hand and count during contractions. And I still remember that 14 years ago. And because before that, he had just... all the things that you learn in birth class go out the window. Yeah. For the birther, of course. It's almost like, why are you even teaching us? You should just be teaching us how to stay calm in situations that don't feel calm. Mm-hmm. But also for the husband, it's not, there's no way that you can educate a human in that much time in what they should be, which is why, we hire doulas. It's our support people to guide us through a situation that we've never been through.
Right. Mm-hmm. Well, like you said, I tell people, this experience, I want to utilize the fact that you have that bond and that trust so that you can take it from birth into your postpartum when you do need a lot of support, and now you can think back to the birth and be they had me then, they're going to have me now. And so it really does forge that trust that your partner's going to be there in the way that you need them to, or at least you can express it and they're going to listen. Yeah. So, I think all this practice hands-on. Like, we do practice positions in our prenatals, and I'm like, you don't have to know much. I'll be there to help you know which position to use, but be familiar with touching her body or their body, and you get comfortable telling them you like it or you don't.
Yes.
And it helps.
Yeah, that's the big part.
And as a caveat, my husband was amazing in my second birth because he just got it after going through it, and that's why you want someone like yourselves to support them in that first one, to help them show up in the best way that they are able to, and really don't know how to the first time.
Right,
like you just don't.
Yeah, they
it's just
don't.
a new threshold. Yeah. Just like a woman doesn't know how to give labor till she does.
Right. I tell people they're like, well, I know how to push. I'm like, probably not, but the first few are like practice, and then you get the swing of it.
Yes.
Seriously.
Yes. All right, so the last page is actions and indications, list at a glance, and point combos. So we talk about with induction, you can try to start contractions / bringing the baby down. So using large intestine 4 on the hand during a contraction, and then have her do some deep breaths and do spleen 6 or gallbladder 21 to get that baby moving down to the right position. And then go back to large intestine 4 during a contraction. And then for presentation issues, again, we're looking at bladder 60 and 67 on the heel, on the ankle, and the foot. And then gallbladder 21, that one if you have a baby that's not in an optimal position, we're using this a little bit to encourage baby to just move, and then we're using the other points to try to tell them which direction they're moving in. And then in terms of pain, we talked about kidney 1, and then failure to progress. Really, I think they're all on here.
Just do them all.
So yeah, again, they all can be used at different times. There's no right or wrong. It's really just how mom is feeling and responding, or how the birthing person is feeling and responding. But yeah, I found it to be very helpful. So anybody have any questions?
I love this.
Yeah.
Yay!
I'm excited to use it with clients.
Okay, good. Well, let me know if you guys have any questions
to do at the print.